Between 1% and 10% of Australian women have endometriosis, a condition where the tissue that normally lines the uterus, the endometrium, grows outside the womb. There is typically a delay of 6 to 7 years between first symptoms and diagnosis of endometriosis. The disease is most commonly progressive, so if women have symptoms and it goes untreated, it may grow and worsen. The only way to definitively diagnose endometriosis is through keyhole surgery or laparoscopy, where a surgeon examines the pelvis for signs of the disease. This invasive procedure requires general anesthesia and hospitalization. Read more. Health check. Are painful periods normal? Many women with period pain, especially adolescents, who could have endometriosis but don't have a laparoscopy confirmed diagnosis or prescribed the pill to reduce their pain. These women may only be diagnosed with the disease once they stop taking the pill and their symptoms return or increase. While early diagnosis is ideal, endometriosis is thought to be less likely to progress while women are taking the pill, making a delayed diagnosis less worrying. But when it comes to managing endometriosis, not all contraceptives are equal. And what works for one woman may not be the best choice for another. What causes edo pain? Most women experience retrograde menstruation, when menstrual blood and endometrial cells move back up the fallopian tubes and into the abdomen. In women with endometriosis, the endometrial cells attach to pelvic or abdominal organs, including the ovaries, bladder and bowel, and start to grow. During menstruation, these rogue endometrial cells form lesions that bleed in the same way as the lining of the uterus. This results in a vicious cycle of inflammation and scarring within the abdomen, which causes infertility, painful periods, painful sex and persistent pelvic pain that lasts throughout the menstrual cycle. Endometriosis can be difficult to diagnose, particularly in its early stages. While the disease is common, many women have painful periods that are not caused by endometriosis. The only way to tell for sure is to have surgery, which women are rightly reluctant to commit to unless symptoms become severe. Contraceptive treatments. Pain from endometriosis can be treated surgically by removing the lesions. If it is all removed or destroyed, then 80% of women will experience improvement in their pain symptoms. Endometriosis will regrow in about 1/3 of women over the next 5 years, so multiple surgeries may be needed. In women with infertility, there is almost a doubling of natural pregnancy rates after surgery for endometriosis. Read more. Women aren't responsible for endometriosis, nor should they be expected to cure themselves. An alternative approach is to use hormonal contraceptives to suppress menstruation or replace it with a milder version of menstruation, called a withdrawal bleed. Suppressing menstruation stops the lesions bleeding and prevents new endometrial cells reaching the abdomen. The most common form of hormonal contraceptive is the combined oral contraceptive pill, which contains estrogen and a progesterone-like hormone, progestin.